a blocked nose that never clears, facial pressure and lost smell, the everyday reality of chronic sinusitis. Chronic sinusitis means the lining of the nose and sinuses stays inflamed for 12 weeks or longer, despite treatment. Doctors recognize two main types: chronic sinusitis without polyps and with polyps, soft swellings that block the nose. Allergies, asthma, nasal anatomy, smoking, and type 2 inflammation often combine to keep the sinuses inflamed. ENT specialists confirm the diagnosis using nasal endoscopy, a thin camera passed into the nose, and often a CT scan. Treatment is stepped. The foundation is daily saline rinses that wash out mucus and allergens from the nasal lining. Steroid nasal sprays are used daily over weeks to months. They are the backbone of long-term medical treatment. When medicines aren't enough, functioning endoscopic sinus surgery opens blocked sinuses so rinses and sprays can work better. For severe polyp disease that returns, biologic injections target the inflammation driving the disease and can restore smell. Most people return to light activity within 1 to 2 weeks after surgery, with full lining healing taking several weeks. Daily habits matter: consistent rinses and sprays, avoiding smoke, managing allergies, and staying hydrated reduce flare-ups. Chronic sinusitis is usually managed rather than cured, but most people achieve meaningful and lasting improvement over time. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.